In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
Let's say hello to Professor Bernd Kleine-Gunk, an expert on anti-aging medicine. Welcome, Professor, to In Good Shape.
Hello.
Hello. Is there a recipe for a long and healthy life?
Well, there is no such thing as the magic pill for eternal youth, but there's a lot of things we can do for healthy aging, because we understood aging more or less on a molecular level. We know the biological mechanisms, and once you know how things work, then you can try to influence them.
But how much is in our genes?
Around 30%. There are twin studies that have proved that quite well, and that means that even if you have bad genes, because you were not so lucky with changing the right parents, you still have something like 70% to make up for those bad genes by lifestyle, by nutrition, by sports, exercise, and so on.
So how exactly do we make up for our bad genes? And so what can I personally do for a long and healthy life?
Well, first of all, it's all those things that our grandma already told us. That is, don't grow fat, exercise, eat your veggies, stop smoking, all these things. I mean, it's quite banal, but it's still more or less the basis of anti-aging medicine. And then on top, of course, you can do more. That is hormone replacement therapy, that is taking certain supplements, that is maybe even taking drugs like low-dose aspirin and so on.
And what can I do without going to the doctor? Is it important for me to stay on the go, to exercise, go and exercise?
Exercise and sports is something like the universal preventive medicine. We know that sport helps to prevent cardiovascular disease. We know it helps to prevent osteoporosis. It even prevents Alzheimer's disease, dementia. So yes, next to good nutrition, exercise is the main thing.
And what about the good nutrition? Are there special foods I should really go for, like the superfoods?
Yeah, there are superfoods, but I think this is a worldwide TV show, so there are different spots on the earth where there is very nutritional food. That is, for example, in the Mediterranean area, that is also in Asia, and so on. So it's mainly really fruits and vegetables which contain a lot of antioxidants and anti-inflammatory substances. So stick to this. Keep away from fast food.
Yeah, and is it wise to choose from nature, like eating an apple, or is it better to go into a pharmacy and grab some pills with supplements?
The apple is definitely the better solution, because an apple does not just contain 12 vitamins as a multivitamin pill, but it contains a lot of other substances. There are 30 to 50,000 secondary plant substances that are important, and it's also the matrix in which they are embedded that is important. So definitely 5 a day fruit or vegetables is better than a multivitamin pill.
What about stress and stress relief? Our viewer Selvaraj Ganesan from India wants to know if yoga and meditation may help you in aging.
Yes, it may help, because there are things that keep you young. There are also things that make you getting old quickly, and stress is one of them, even from the point of hormones. There's a stress hormone called cortisol, and we know that high cortisol level are really pro-aging hormones. So to lower them, something like yoga is okay, meditation is okay, coming down. Even if you have an iPhone, it has to, recharge its batteries, and
Right.
The same is true for us.
The right choice, testosterone replacement therapy. When would you advise patients to get testosterone treatment?
Well, first of all, there should be some complaints, night sweats, depression, loss of libido. And then there should be a lab test that really shows that the testosterone deficiency is the cause of these complaints. And then hormone replacement therapy with androgens makes sense.
So you need both the complaints and the test results. And if you don't want to see your doctor and still want to boost your testosterone levels, perhaps by natural means, so can you boost it by yourself without taking in drugs?
Yeah, 2 main methods. The one is exercise again, mainly muscle building. Second is reduce your body weight, cut down on your fatty tissue.
How does this help?
Because in the fatty tissue there is a certain enzyme, the aromatase, and this is metabolizing testosterone into estrogens. So especially with elder men who have little testosterone and they go overweight, then they have the little testosterone that they still have metabolized into estrogens, and then they really get into hormone deficiency.
Estrogens is not really good for men, it's better for women because it's a sexual hormone from men.
Men too need some estrogens, but too much, of course, is not what men want.
Okay, so let's talk about women. There's a lot of discussion going on about hormonal replacement therapy in women. Is this an anti-aging method?
Yeah, the discussion indeed was very controversial, especially in the beginning of the new millennium. There were some studies from the United States, WHI, that showed that hormone replacement therapy is leading to higher risk of breast cancer, thrombosis, and so on. And since then, we have learned a lot and we have changed a little bit the regime. We now work more with bioidentical hormones. We prefer to give estrogen the transdermal way. With this, it has become safe and it has become, again, an anti-aging medicine.
And transdermal means with patches and with creams?
With patches or with gel, yes.
And this is safer than just giving pills?
Yes, definitely. It is reducing the risk of breast cancer, it's reducing the risk of thrombosis, and those were the main two risks of hormone replacement.
And does it make women look great? Is it good for the skin too?
It does, yes. Estrogens have effects on many parts of the body, and skin and mucous membranes are part of it. So definitely estrogens are also the hormones of beauty.
So what's on the horizon of anti-aging medicine? What can we expect in the next 10 years, say?
Yeah, there are different scenarios. The one scenario is that we are shifting from preventive medicine to regenerative medicine. So we have, for example, stem cells. That is, one of the big visions of anti-aging medicine, that one day we are able to regenerate cells, tissues, and so on. Then there is, I might say, a radical line in anti-aging medicine called radical life extension. Operator Gray is one of the spokesmen. And they say healthy aging is not enough. We want ending aging. So, for example...
So living forever.
Yeah, living forever. I mean, the thing is, will it come? The other one is it really desirable? I mean, eternity is a mighty long time, especially towards the end.
But this could be desirable if you stay healthy on the way, and you try to do that everybody's staying healthy on the way.
Yeah,
Thank you, Professor Kleine-Gunk, for being with us in the studio. Let's
Thank you
hope
very
that
much.
you grow old and be healthy.
Thank you.